Bismillahirrahmanirrahim. Assalamu alaikum, my dear students. Hope everyone is safe and sound. Today we will be discussing about distribution of drugs. Distribution of drugs is defined as when drugs are administered into our body through various routes. They are absorbed into the systemic circulation, from where they are distributed to various organs and tissues where they will produce their effects. So, whenever drugs are administered through any route, as we have discussed in the routes of administration, there are two routes: enteral route, which are three routes: oral, sublingual, and rectal. And parenteral में we have injections, intramuscular, intravenous, subcutaneous, intradermal. Then we have inhalational and topical route. So administration of drug to any routes, after these they are absorbed into the systemic circulation, which is known as drug absorption. But after the systemic circulation absorption, the drug will be distributed to various tissues and organs. So this distribution is known as distribution of drugs. So distribution to various parts will occur in minutes. जैसा कि when जब थोड़ा सा पेन होता है and we take a painkiller, तो by any route, intravenous, oral, तो that painkiller is absorbed and then distributed, and within minutes जो पेन होता है वो रिलीफ हो जाता है. So this is the in minutes the drug will produce its effect after once it is absorbed and distributed. So the drug is first distributed to those parts of the body which have rich blood supply, like heart, liver, kidneys. इन organs की blood supply चूँकि ज़्यादा है, तो ड्रग जो है वो फर्स्टली डिस्ट्रीब्यूटेड होगा टू दीज organs which have rich or high blood supply, while the organs like skin, muscle, adipose tissues, they have relatively less blood supply. इसलिए distribution of drugs to these organs is a bit slow or delayed. Factors affecting drug distribution: there are several factors which will affect the distribution of drugs. The first factor, that is lipid solubility. Lipid soluble drugs are distributed easily throughout the body because they can easily pass through the lipid cell membrane, while lipid insoluble drugs are poorly distributed. Chunky cell membrane is made up of lipid, which is a lipid bilayer, and it's the law of nature, like dissolve like. तो lipid soluble drugs जितने भी होंगे, they are easily soluble and they can easily pass through the lipid cell membrane. So जितने भी drugs lipid soluble होंगे, उनकी distribution is easy as compared to those drugs which are lipid insoluble. The second factor is blood supply. So as we have discussed in the previous slide, that the organs like lungs, liver, kidney, heart, which have rich blood supply, the distribution of drugs to these organs is easy and fast, while those organs which have relatively less blood supply, like skin, adipose tissues, muscles, the distribution of drug is a bit delayed. The third factor, that is tissue affinity. Some drugs have more affinity for different organs. Means some drugs have more liking for some organs to be distributed, जैसा कि thiopentol has high affinity for the adipose tissues. तो जब भी हम thiopentol administer करेंगे through any route, तो first it will go into the adipose tissues because of its high affinity for adipose tissues. The fourth factor, that is blood-brain barrier. As blood-brain barrier is also lipid in nature. So while those drugs which are lipid soluble, they can easily pass or cross this blood-brain barrier, reaching the central nervous system, the brain, and when it produces effects like diazepam हो गया, thiopental हो गया, etc. All these can easily cross the blood-brain barrier. While many drugs they cannot pass the blood-brain barrier, so that's why the distribution of these drugs to the brain is impossible. So the drug having lipid solubility can easily pass through blood-brain barriers, otherwise it will not the blood-brain barrier apparatus is lipid insoluble. The fifth type is redistribution of drugs. Some drugs which are lipid soluble, after its distribution to organs with higher blood supply, after producing their effects are redistributed into the blood and distributed to other tissues of the body. बाज़ lipid soluble drugs जो है when they are distributed to organs with higher blood supply, और वहाँ पर अपने इफ़ेक्ट्स को प्रोड्यूस करने के बाद वो वापस सिस्टेमिक सर्कुलेशन में ब्लड में आ जाते हैं. द ब्लड विल डिस्ट्रीब्यूटेड टू द अदर टिश्यूज़ ऑफ द बॉडी. दिस इज़ नोन एज रीडिस्ट्रीब्यूशन ऑफ ड्रग्स. सो जैसा कि थायोपेंटॉल की एग्जांपल ले ले, इट विल बी डिस्ट्रीब्यूटेड टू द एडिपोज टिश्यूज़, और एडिपोज टिश्यूज़ में बिकॉज ऑफ टिश्यू अफिनिटी इट विल प्रोड्यूस इट्स इफेक्ट्स, और ये वापस ब्लड में आ जाते हैं. द ब्लड विल डिस्ट्रीब्यूटेड to other organs of the body. Thank you very much. That was all about drug distribution. It's a simple छोटा सा topic है, but it's a very important.